Hello everyone, you are all welcome to lecture number 1282, and today's topic is childhood autism causes, symptoms and treatment. When we are talking of autism, it means it is neurological disorder, brain disorder, and it is having the problem of communication with children, and those children who are suffering from this autism disorder, it is also commonly known as autism spectrum disorder, that is ASD. And if your brain structure and function is not proper, means in the case of children and even in adult, then we can get this type of disorder. So the symptom is that first they will be having difficulty or even in total communication, verbal communication, they will not communicate. Secondly, the social communication. Also, social communication means non-verbal communication, means eye contact, then sensitivity to family members, to any condition, and emotion. All these expressions in his or her social behavior will not be prominent. And that child who is suffering from this autism disorder will be having the problem of social behavior also, and he will not be having normal social behavior, and whatever responses from environment, from surrounding, from society is there, where it is expected that he will show the positive response, will not be there. So these are all the symptoms, and nowadays lot of research publications are going on. And here let me mention, I have gone through the statistical data. The number one country is India in autism spectrum disorder. It goes up to more than 800,000 children. Second number goes to China, is around 500,000 children. And third number is Nigeria, 170,000 children. They are suffering in the age group of starting from 3 to 9, around 5-6 years of age. And of course, once this condition is persisting, is not treated, even during adulthood, they will be having this condition. And here, as per the latest research publications, they are mentioning that it is because of the brain development, and they have mentioned in some of the publications so many factors. So one by one I am giving. They have found that those children who are having autism condition, spectrum of autism, because it is in grade spectrum, it is intellectual disorder, some of them commonly they will call it. So it's somewhere it will be, in some child it will be low, that is grade, somewhere it will be high in grading, or we can say acute and chronic condition of autism. So communication is the serious issue for such type of children. And as per latest research publications, we know that our brain development is mainly divided into two portions. One is frontal lobe cortex, and the other one is emotional. So emotional side of the brain is controlling your emotion, and the cortex frontal side is responsible of your language processing, communication skill, all those behavior things, reasoning and thinking. So they have found that in those children who are suffering from autism, that is intellectual disorder, the size of the emotional brain is bigger and more active as compared to normal children, where the size as well as activity of cortex, frontal brain of reasoning, thinking and communication is more active. So that is the disbalance of brain structure and brain activity of two portions. One is emotional and other one is cortex, communication and language processing. So that is one of the main reason is given. The second factor they are discussing in the research publications is nutritional deficiency during pregnancy period. So those nutritional deficiencies are first condition they are putting, that those pregnant women who are deficient, who are lacking vitamin D deficiency or exposure to sunlight morning and evening, so that enough vitamin D is produced to support all the activity and immune system. Then second, folic acid, that is called folate, is vitamin B group, that is B9, and the other one is B12. So if these two deficiencies are there, again the development of the brain at genetic level, DNA level, will not be normal and proper. And then nowadays they are linking another element, that is zinc. They have found that, there are latest research papers, that those children who are suffering from autism spectrum disorder disease, they have low percentage of zinc in their blood, and that is also one of the factor, because these biologically active elements, they also play very important role. And what they are suggesting in research paper, that if you have such type of child who is suffering from autism, that is called childhood autism, please make sure that two things are avoided, not given. Two type of protein. One is a vegetable protein, and that is called it is found in cereals, and most of the children, they are allergic to that. And the animal one other protein, that is casein, is found in mainly milk, so it should be avoided. And that cereal protein is called gluten. So gluten and casein should be avoided, because it will trigger some allergic condition, and definitely that is going to harm the brain activity. And this type of condition, the people who are suffering, is a serious alarming. In Africa, for example, if you go by the percentage of the population, that is Egypt is having up to 33 to 34% population, they are suffering from autism, and the maximum number of patients who are having this disorder in globally goes to Qatar in terms of percentage of the population, and the lowest sufferer of autism, France. In France, this condition is very much low. So these are all conditions, and there are many, very many, we can say scientists, technocrats, they have some low-grade spectra of autism. For example, Elon Musk accepted that, yeah, he's having the condition of autism. And the researchers, they have mentioned that even our genius is equal to MC square man, means that is your top scientist. he was suffering from autism, and I will give the list. It is published there. There are lot of top-ranked scientists and very successful people. They have some low grade of autism. Einstein, Albert Einstein, they have mentioned that he was having the autism condition. Autism condition means your social behavior is not normal. You are withdrawing from some of the social responsibilities, social behavior. You are very much within yourself. That is also one of the factor, one of the condition, one of the symptom of autism. And there are many top-ranked scientists, technocrats, even icon film actor and actresses. I will not mention name because it is health condition, but if I am telling, they will know. In Bombay, in Indian film industry, there are some of the actor and actresses, they are suffering from autism disorder. Because that disorder is combined with their anxiety built up, stress and depression. And once I am talking, you can understand, and they will know that what Professor Khan is saying is correct. It is all health condition. And the treatment of such child is very expensive. So it is very difficult for poor people to treat such type of symptom like autism, childhood autism, especially in poor countries like Asia and Africa. So this is the forum where I can call the attention of World Health Organization and also UNO, United Nations Organization, to come forward and put this health condition, this neurological brain disorder, intellectual disorder on priority list. Because it is, we have millions and millions of people who once in childhood they have developed, and if it is not recovered properly by training, by teaching, then definitely there will be liability. Of course, it is called spectrum, autism spectrum disorder. That is ASD. Spectrum means grading. So if it is up to low grade, people may not identify, may not characterize you, but you know it, that you are suffering from this type of neurological disorder. But if it is chronic, of high grade spectrum, definitely you are abnormal, and in society, your productivity will not be there. So I am going to give the summary of Alvin. Before that, I will show you some images. So here it is shown that non-verbal communication. I have already told you that those children who are suffering from autism, they suffer from verbal communication as well as non-verbal communication, means body language, eye contact, face expression, then sensitivity to family members. So this group is showing that they are all having 7 type of non-verbal communication, and they are suffering from the disorder that is called autism. In this image, they have shown that in a school, while they are teaching such children who are suffering from autism, childhood autism, so they will give them some game. They will teach them how to go to bathroom, how to clean your hand, your face, to play with others, how to socialize. All these things they are slowly teaching, and then they will try slowly to balance 2 communications. One is verbal and another one is non-verbal, because this child is only concentrating on one side without showing any social or verbal or communication response to other side. This is the image of teacher who is teaching a child who is suffering from autism, and that is acute autism. So he is calling his attention and he is trying to talk, to express, and that boy who is suffering from acute autism, is not showing any response, any emotion, any sensitivity towards his teacher. So this is the chronic condition of autism. It means unless lot of work is done, his recovery up to 90%, 80% will be very, very difficult. So I have given in the form of summary for those families who are having such type of health problem in their children in the age group of 5 to 9, or even some of the adults, they have the autism problem. So they can follow like that and they can understand very well. So number one, they should understand what is the meaning of autism. Autism, also known as autism spectrum disorder, that is called ASD, and I have given lot of explanation. I am not going to explain again. And it is a neurological disorder where brain is divided into two, emotional and frontal, that is reasoning and thinking, in that size structure disorder, and development of brain that affect the communication, social interaction and social abnormal behavior. So communication as well as social interaction, insensitivity to family members and also around immediate surrounding. And number two, childhood autism, that is called ASD, autism spectrum disorder, is characterized by differences in how child perceive and process information from their surrounding environment. That is the main, you have to understand that how he is receiving the all the information or social conditions of his immediate surrounding, nature, plant, tree, everything. Then number three, causes of childhood autism. There are a lot of publications nowadays, it's still coming, and they are discussing a lot of factors. So I have given those factors here. I will just tell you. The first factor they are mentioning is genetic factor, where genetic, if I say, means genetic material is DNA, deoxyribose nucleic acid, and there is some mutation, some change. So mutation means some change in the DNA sequence, and that may be positive, that may be negative. So if it is negative, child will suffer from autism. If it is positive, he might become genius or very intelligent. So that is one of the factor, that is gene mutation and variations of gene. Number two is environmental factor. Sometimes your family or your child is exposed to lot of heavy metal, toxic material, or even air pollution, like what is happening in India, Delhi and some many mega cities. And then nutritional deficiencies, that also comes under environmental condition. And nutritional deficiency, I have already told you, for pregnant women during pregnancy, like folate deficiency, that is B9 group, B12, zinc and vitamin D. And number three, brain structure and function. That plays important role. I have given enough discussion that how the emotional and reasoning thinking brain, their size, that matters. Then number four, symptoms of childhood autism. What are the symptoms your child will be having? Because sometimes when child is very young, maybe if he or she is only 1 year or 2 years, sometimes it's very difficult to understand or to identify that this child is suffering from autism. So what are the symptoms? You should try to notice from very beginning. Number one is verbal and non-verbal communication. I have already told you the verbal and non-verbal. Verbally, he will not be talking. Secondly, non-verbal communication, his eye contact, his sensitivity for family members, surroundings, all these things you can notice. He will not be socially normal, sensitive child. And of course, in communication, he will be silent. So these are the factors and symptoms. And number two, social interaction. That cover. Interaction means he will not be sensitive to father, mother, or the behavior with other family members. Number 3, repetitive behavior, that is hand flapping, body rocking, and strong focus to some particular object. That is also, it shows that he is on the road of autism. Then number 3, that 4, that is your sensory perceiving. Sensory processing means difficulties, and that is hypersensitive. He will be hypersensitive to light and to sound of music. So once he is not feeling comfortable very quickly, it means that he has problem of autism. So here this segment is very important. I have given some points how to manage and treat the child who is suffering from childhood autism. So here number 1 is applied behavior analysis therapy, that is called ABP. It is a type of therapy to help the child to develop skills for daily routine work, like how to change the clothes, dressing, going to bathroom, toilet, doing his small work. That is called applied behavior analysis therapy, and there are expert teachers for such type of training. Number 2, language therapy. Also they are trained teachers. This therapy helps child to develop communication skills. They are expert to make the child to learn and communicate slowly. And number 3, medication. Medication is also given if the child is having lot of emotional disorder, anxiety, and sleeplessness, is not sleeping in the night. Then consult your doctor. Doctor will put on some medication, and then create a supportive environment. So this is indoor supportive environment by father, mother, parents, loved family members. Structured environment and predictable environment means, structure means regular habit, kissing, hugging, and playing. All these things are included in that. That is called create supportive environment. Then number 5 is use visual support. Use visual aid such as pictures, and that pictures, when it is shown, the child will try to understand the environment and immediate surrounding, all these things. Then number 6, encourage communications. Always encourage child to communicate with autism, that is using augmentative and alternative communication device, that is called AAC. Then number 7, provide platform for socialization. Always if there is some function, birthday or any type of gathering, you take your child and let him interact with all the friends, loved ones, so that it will develop his behavior and communication skill. And then number 8, allow autonomy. So it is very important, because in many cases the parents, they don't allow to take any decision by the child. No, don't restrict. Just give him or her freedom of decision making. That is called autonomy, so that he will take decision and he will act accordingly. Then I have given here the global childhood autism in countries. Number 1 is India. In India, we have 851,000 children who are suffering from autism. Second number goes to China, which is having 422,000 cases of autism, childhood autism. And number third is Nigeria. In Nigeria, you have 172,000 childhood autism cases, and globally, 4.7 million children are suffering from this neurological disorder that is called autism. So with this, I will stop. Thank you very much for watching the lecture.